Welcome to my podcast. Today I'm going to talk about a case of COPD, which is chronic obstructive pulmonary disease. So basically, the patient will come to you for either annual checkup or for some symptom of infection. So the patient will tell you that I have already been diagnosed and I'm having too much cough or too much phlegm are getting a recurrent infection from time to time, whereby he needs antibiotic. So you will start off by introducing yourself and double checking the patient name, date of birth, and address. And then ask, how can I help you today? I can see from your note that you've been diagnosed with COPD. So how things going on so far? The patient might tell you, I'm okay, or maybe tell you that I'm having recurrent infection, I'm having cough, having difficulty in breathing, shortness of breath. So we'll explain to the patient, do you know what COPD means? You will describe that it's a narrowing of the airway, which is irreversible due to the damage being happened to the bronchus, and you will ask the patient, because most of those cases the cause is mainly smoking. So the patient will tell you, I've been smoking for quite a long time and I'm not able to give up that. So you will ask, have you tried or have you sought any help about doing so? Because this is a main factor for exaggeration and worsening of COPD. So also you need to ask if the patient is taking any medication, for instance, the blue or the brown inhaler. So the blue is the Ventolin and brown is steroid. The patient might tell you, yes, I'm taking this from time to time whenever the symptom is exaggerating. You will ask how often he's taking that and for how long. You will also ask if he's working, if it's impacting his work. You will ask if it's impacting his general health and sleeping. Also, you will ask if there is any sputum or phlegm, and what's the color and the amount of that phlegm. And also ask if there is any associated wheeze, and what antibiotic did he take so far, and been prescribed by the GP. After exploring all of that, you will ask if there is any other medical condition maybe he had, and what medication he's taking regularly, or OTC, maybe he's taking over the counter by himself. So you need to inquire about all of that, and also not to forget about any history of allergy, say for instance to food or any particular medication. And since you asked about the smoking, you need to stress about the importance of stopping and quitting smoking. So you need to ask if he has any interest to do so, or he might need help. So you could direct him to the nicotine replacement therapy. Basically, there are two types, and this will help for the craving, for the taste, and you need to warn the patient that there will be some displeasant taste, so he will be prepared for that. And also you need to ask if there is any reason why he's not stopping the smoking. Maybe the patient will tell you it calm his nerve or improve his mood. So you will try to understand his point of view. You could also direct the patient to a support group, whereby he can liaise with other people in the same boat, so they can help each other. Also, offer to refer to the smoking cessation clinic, whereby they will help with quit smoking. Also, tell him about if he needs any help, he can approach a smoke-free national helpline, whereby there will be no judgment at all, just a friendly way of talking and explaining the situation. If all of that has been failed, you could offer medical management, as I mentioned, nicotine replacement therapy, which can be in the form of a patch or spray or chewing gum. All of that, of course, it has a low level of nicotine, so this will help with the smoking if the patient been smoking for quite a long time, and it will help with the unpleasant withdrawal effect. Say, for instance, the craving, bad mood. Also, you can advise or offer the e-cigarette. It's not risk-free, but it's much safer than the cigarette itself, or also as nowadays the vaping, though it's not risk-free as well. It has a little amount of nicotine as a substitute for smoking. So all of that you need to bring to the patient attention in order for the patient to make his own decision, and says that he's happy to consider that and act on it and seek help. So also you could encourage the patient about lifestyle changes, like, for instance, the kind of diet they take, and encourage physical activity. All of that will increase fitness and minimize the level of the stress, because walking or any sort of physical activity, it can boost the mood and improve the well-being. So also you could encourage about joining a yoga group to improve the mood level and fitness and minimize the stress as well. You need to tell the patient that by stopping or minimizing smoking, the airway won't be back to normal, but it won't progress any further because the damage which has happened, you need to explain that to the patient, that the damage which already happened is irreversible. However, with the stopping, it will not progress any further, and it should improve rather than exacerbate the condition from time to time. And also you can point out about the risk associated with continuing smoking, apart from the COPD, like the risk of heart attack, stroke, and the risk also if there is any high cholesterol level. All of that will damage the blood vessel on the long run. So by that, I hope that I covered COPD and the points that you need to address when you present with chest condition and lab 2 station. Thank you.